Depression is a common mental health disorder that leads to things like challenges with eating, challenges with sleeping, low mood of course, increased agitation, all these kind of things that we can generally understand. But how do you know if you actually have depression? Fundamentally, 1 in 6 of us every single day over the course of a week will experience symptomologies of depression. But is there a difference between experiencing symptoms of depression and actually being diagnosed with clinical depression? Well, on this week's episode of GetPsyched, we're going to find out. The first question that we have to ask is, what exactly is depression? Now, we can all understand the symptomologies of depression. We can all understand that element of low mood, those challenges with eating and sleeping that we've already gone into. And we can all understand that, one of the main symptoms of depression is changes in enjoyment in things that you used to take enjoyment in. So if you're an artist, if you play music, and you no longer enjoy doing those things all of a sudden, then that can be a key symptomology of depression. Likewise, we can all understand the kind of things that trigger symptoms of depression. Things like a loss of a job, things like the loss of a partner, or even the death of a loved one. These kind of things can initiate those experiences of depression. One of the things that we have to take into account though is the difference between experiencing depression and actually clinical depression or being diagnosed with depression. The NHS state that in order for you to start to be considered for diagnosis of clinical depression, you have to be experiencing a number of those different symptoms that we're going to go into in a little minute over the course of every single day for about 2 weeks at least. At that point, that's when you need to see your GP and start to go through the process of potentially being diagnosed with clinical depression. Now, there are numerous different symptoms of depression. There are objective symptoms of depression, and we're going to go talk about those in a little bit. But one of the things that I really want to keep in mind for this video is that any kind of diagnosis or any kind of experience of a mental health difficulty is always very, very subjective. There are, of course, objective overviews. There are objective symptomologies that we can all appreciate are associated with certain mental health disorders, and that's definitely the case with depression. But there's also something to be said about a subjective element to this. There's something that's going to be applicable to you only that's not applicable to someone else. And it's really important that you keep that in mind when considering if maybe you have depression or not. Now, let's look quickly at some of those objective symptoms of depression. Like I've said already, they include things like fatigue, chronic fatigue even, real changes in eating patterns. So maybe you're excessively hungry, maybe you're not hungry at all. Also changes in sleeping. Now, again, this is where subjectivity comes into the equation here. You could be sleeping way more than normal. You could be consistently tired. You could not be sleeping whatsoever. You could be sleeping a couple of hours a night. So long as that's a real change in what's normal for you, then that's when we start to consider whether or not that's a symptom of depression that you might be experiencing. There's also something to be said here about agitation and irritation. Maybe situations or people that didn't agitate you in the past perhaps start agitating you now. The same goes for situations that you're experiencing, perhaps even at work. Likewise, like I said earlier, one of the biggest symptoms or one of the biggest recognizing factors of depression is starting to not enjoy things that you used to enjoy. And I use that analogy of the musician or the artist. It could go the same for anything. If you're playing sport and you no longer really enjoy playing that sport and you have some of these other objective symptoms, it's probably appropriate that you check in with yourself a little bit and start to unpack whether or not you're experiencing depression. One of the keys to understanding whether or not you are experiencing depression is to kind of bypass some of the myths and misconceptions about depression. I feel depressed or that's so depressing are very common colloquial terms that we use in society today. We use them in everyday language and it kind of belittles what depression is really all about. For example, there's a real difference between clinical depression and actually feeling low about something. Again, an example, you might feel low about losing your job. You might feel low about ending a relationship. You might feel symptoms of depression after the loss of a loved one. That doesn't necessarily mean that you're automatically going to be diagnosed with clinical depression though. Now, of course, you should feel low. This is one of the misconceptions. You absolutely should feel low after you lose your job. Of course, you should experience elements of depression when you lose a loved one. There's a real difference between that and actually clinical depression though. Now, don't get me wrong. These kind of things, these kind of situations can absolutely trigger the initiation of clinical depression. Losing a job, losing a relationship, losing a loved one, all of these things can initiate clinical depression. But it's very, very normal for you to feel low and even experience symptoms of depression as a result of these things. And those are not to be misconstrued with actually a diagnosis of clinical depression. One of the key things with clinical depression, or again, this is subjective, but one of the key things with clinical depression is that at times it can seem to come from nowhere. Of course, there are times trigger situations, like I've just explained, that can cause elements of clinical depression, but clinical depression can be a sustained thing, a number of different factors contributing into one overall change in your mood, change in agitation, or change in the things that you used to enjoy. So there can at times be the case when clinical depression really kind of comes out of nowhere. One of the other misconceptions that we need to get past when we're thinking about the difference between feeling low and clinical depression, or a diagnosis of clinical depression, is the grief cycle. If we're using those analogies again, loss of a relationship, loss of a job, loss of a loved one, it's very, very appropriate for you to be experiencing a grieving process. Not only is it appropriate, but it's absolutely vital for your recovery and ultimately coming to the stage of acceptance. What can often happen is that people overlap or people misconstrue grieving with clinical depression. Now, again, don't get me wrong, there's parts of the grieving process that do have very similar factors to depression. Things like extreme sadness or low mood. Those are parts of the stages of process in a grieving process that are also mirrored in clinical depression. So it makes sense that at times these two things can be misconstrued. But please, if you're understanding one thing about the difference between clinical depression and just relative low mood, it's to know that the grieving process is absolutely natural. It's normal. It's needed in order for you to get to that stage of acceptance. There's a real difference between that and clinical depression though. There's still a lot that we don't understand about what initiates depression or what actually causes clinical depression. As much as the research has been developing over the number of decades that have passed in the area of depression, there's still plenty we don't understand. And when I said earlier that at times clinical depression can kind of almost come out of nowhere, that's still the case. It might not be the answer that many people are looking for, but it's absolutely true. Sometimes this kind of thing can just come out of nowhere and it's very difficult to understand where it's come from. At times therapy can definitely help us unpack the reasons behind it. That's one of the keys to treatment. But initially it can just feel like it comes out of nowhere. So what are some of the other reasons as to what causes clinical depression or what causes experiences of depression? Well, we can look to things like social factors. That can be the case where, you start feeling isolated, or you realize that your social circle has diminished, or you're not the person that you once were. All these kind of things can be maybe bracketed within social factors that lead to clinical depression. There's also something to be said about a psychological factor here. If you've been recently diagnosed with a terminal illness or serious illness, that's going to have psychological ramifications for you that can ultimately lead to experiences of clinical depression. The same goes with those old analogies that I've used already, the loss of a job or the loss of a relationship. That can have psychological ramifications for you too, that ultimately will potentially lead to a clinical depression experience. There's even something to be said here about a genetic factor. Now, this is always up for debate, but more and more, some researchers are starting to say that if your parents have experienced depression, then you're much more likely to experience depression. Now, I absolutely agree with that. However, can we ascertain or can we conclude that that's as a result of a genetic factor? Or is that a result of more of a social factor where the fact is that you've just been in their environment more and you've learned lessons from them on how to deal with situations? There's a difference between that and actually starting to state that there's a genetic factor, that this is a hereditary thing, that if your parents have experienced depression, then you're going to experience it. There's a bit of a difference between that and actually just being in those parents' environments and learning off of them. I was reading a report the other day, it's been the 50th anniversary of the Troubles in Northern Ireland, and they were talking about vicarious trauma. And this was where, children are experiencing the trauma of the Troubles in Northern Ireland vicariously through their parents, even though those children did not experience the trauma, the Troubles directly. What's ultimately happening is that the ramifications that those parents have experienced off of those Troubles after the things that they've seen has influenced their depressive states, has even influenced post-traumatic stress disorders, and they're implementing those unconsciously onto their children. Is that a genetic factor? I don't think that necessarily is. I think that's just more that the children are experiencing life patterns and lessons that their parents have learned after some really, really traumatic events. So we've got to be really careful about this genetic factor that some researchers are arguing for with regards to depression. So the big question, how do you know if you have depression? Well, we've covered a lot in this video already. We've looked at kind of what depression is, we've looked at some of the misconceptions around depression, the differences between depression and low mood, and we've also looked at how the different factors can contribute to causes of depression. That big question kind of still remains though, how do you know if you have depression? Well, I want to come back to something I said at the very start of this video. This is subjective. All those things that I've spoken about are objective. They're kind of umbrella or blanket or family niches or terms that are applicable to different experiences of depression. They might not be applicable to you, But you can take those objective principles and apply them to your life. You'll understand yourself better than anybody else. Take that subjective element, understand yourself a little bit better. Has there been changes in your presentation, your mood, your personality? If so, and if some of these objective principles apply, then the chances are maybe you are experiencing elements of depression. One of the key things, one of the absolute vital things that you have to do though, as soon as you think that maybe there's a clinical depression or a depression element going on for you, is to seek advice from your GP. That's ultimately where treatment starts right now. So I've kind of already gone into this a little bit, but we need to think a little bit about how you actually seek treatment or what you should do next after you think you have clinical depression. Like I've already said, go and see your GP. That's really your first line, your first port of call in order to experience some treatment. There are a number of different options after that. At times people might be prescribed medication, antidepressants. Now those are always controversial topics and everybody has their own opinion. I express the need for you to perhaps do a little bit of your own research. Think about whether antidepressants are right for you. What I'm going to do is I'm actually going to pop a link above my head here about last week's episode of GetPsyched where I looked at antidepressants versus therapy. That's going to tell you everything you need to know about antidepressants, SSRIs, and actually the difference between antidepressants and therapy. I'm a little bit biased as a counselling psychologist in training, but I 100% believe that therapy is the primary focus of treatment for anyone experiencing depression. Accessing therapy is definitely a beneficial thing that you can do. Again, I'm going to pop a link above my head where I looked at a video on GetPsyched a number of months ago about what exactly therapy is. You'll hear so many different misconceptions about therapy, different modes, different ways of conducting therapy, and some are better than others. Ultimately, if you see a qualified therapist who's good at what they do and you're willing and invested in the therapeutic process, then ultimately you're going to reap benefits. So if you're experiencing some of those clinical depression elements, go and see your GP, consider medication if you think it's appropriate for you, and definitely consider therapy. Thanks so much for watching this week's episode of GetPsyched, guys. Really hope that you've enjoyed today's topic on how you know if you've got depression or not. And if you have, you're definitely going to enjoy one of our latest videos all about antidepressants versus therapy. Make sure to check it out here. You can like today's video, you can comment on today's video, and you can also subscribe to GetPsyched here. We do weekly videos all about mental health and psychology, so make sure to check us out and subscribe.